Good afternoon. Lisa Homa here. Hope you're all having a great day. Today we're going to talk about the nurse's role in health assessment, collecting and analyzing data. The objectives of this lecture are to apply relevant anatomy and physiology to health assessment so that you can successfully complete the learning activities and also to be able to practice everything that you're learning through Shadow Health. So the first lecture of this week, lesson 1, talking about health history, we really got into the guts of health assessment. This lecture is just a little overview in case you have some cobwebs and you haven't talked about the nursing process in a little while. So we're going to just go over that kind of stuff, and there's a little bit more fluff. So we're going to just move pretty quickly just to make sure we're all on the same page. So of course we have assessment of our patient at the bedside, and then we have all the other stuff that drives us crazy, which is the politics, the administrative oversight, and managed care. And so the current focus on managed care and internal case management has had a dramatic impact on the assessment and structure and components of the nurse comprising the whole nursing assessment. Assessment can look different for each of us depending on which practice setting that you are in. If you're in acute care, there's a checklist that we have to do to satisfy the Joint Commission. In critical care, again, another checklist in order to satisfy the Joint Commission, but with a little bit more focused on certain areas in order to improve care and outcomes for that specific population. Ambulatory care has its own set of guidelines and again has some Joint Commission oversight, but our assessment is going to look a little bit different, again, depending where we practice. And home health, we have an OASIS assessment, which is even different. So in this course and in our program, we're going to talk about holistic health assessment many times. And again, holistic assessment, if you didn't get it the other 25 times that I mentioned it, is that we're not just focusing on the physical problems that surround a patient, it's the systems theory perspective of it, meaning what are all the other influences such as psychosocial, mental health, support systems, socioeconomic status, spiritual, all those good things. So in a holistic assessment, we want to be ensured, just like a regular assessment, you want to make sure that you collect subjective and objective data to determine the client's overall level of functioning in order to make a professional clinical judgment. We want to make sure that we provide a physical medical assessment, so that is the physical part of it. And then we also want to make sure that we focus on the client's physiologic developmental status. So again, what if you had a patient with cancer? Let's say they're terminal, or you have a COPD that is at end phases of life. We're not going to cure some patients, right? Not every patient has a great outcome. So we have to create the best quality of life for them for wherever they are. So here's a question. Is the following statement true or false? Physical medical assessment collects holistic subjective and objective data to determine a client's overall level of functioning in order to make a professional judgment. I hope you answered correctly. False. Holistic nursing assessment collects holistic subjective, objective data to determine a client's overall level of functioning in order to make a professional judgment. Physical medical assessment only focuses on the patient's physiologic developmental status. Okay, and this is the review where we're trying to dust off the cobwebs. We're going to go over the nursing process, and I'm not going in depth, just going to hit the steps very quickly. So if you never learned the acronym ADPI, it is assessment, diagnosis, planning, implementation, and evaluation. What's interesting about the nursing process, created by Ida Jane Orlando in 1964, there's your little thing. She also had a nursing theory, so you can look her up. You begin and end with an assessment. The assessment at the end, you have to do in order to evaluate what has been done. Here's a question. What occurs during the assessment phase of the nursing process? Is it A, collect subjective and objective data, B, determine outcome criteria and develop a plan of care, C, carry out the plan, or D, assess whether outcome criteria has been met and revise the plan as necessary? Answer is A, assessment of collection of subjective and objective data. We're going to keep moving. Steps of the health assessment include preparing the assessment for the client record, reviewing the client's status with other health team members, so that's the collaborative piece, like on daily rounds or wherever it is that you're practicing, and educate about the client's diagnosis and their testing. So collecting subjective data. And the components of this could be some biographical data, history of present health concerns, so that's history of present illness, the HPI, physical symptoms related to each body part or system, past medical health history, family history, and health and lifestyle practices. And we talked about these in depth in the other lecture this week. Collection of objective data includes physical characteristics, so they are not subjective in nature, bodily functions, appearance. So when I'm doing the physical exam, how does the skin look, or behavior? Something that we can measure or we can document very clearly. Measurements like an abdominal girth or a calf measurement and results of laboratory testing. Steps of the health assessment include validation of assessment data, documentation of the data, and analysis of the data. And I'm sure you do this every day. The analysis phase of the nursing process includes identifying abnormal data and the strengths, clustering the data, drawing inferences and identifying problems, proposing possible nursing diagnoses, checking for defining characteristics of those diagnoses, confirming or ruling out nursing diagnoses, and then drawing conclusion. So many of us can have assumptions about things, but assumptions are really just like a hypothesis. It's when we actually take all the data we've collected and then we actually draw a conclusion. That's actually part of the scientific research process. And there are several types of assessment. So there's 4 types of different assessments that we can do as nurses. We can do an initial comprehensive assessment. So that would be like equivalent to an admission assessment when a patient comes in to see you in acute care. Then ongoing or partial assessment is data collection that occurs after the comprehensive data. So let's say you do the full admission assessment, and then this is like your assessment 8 hours later. Then a focused problem-oriented assessment is thorough assessment of a particular client problem. So let's say your patient came in with a head bleed, and that would be a neuro-focused assessment. It does not cover all the areas, but it's probably the most life-threatening or highest priority assessment of all of those. And then the emergency assessment, which is very rapid, where you don't care about their psychosocial influences at that time. You just care about if they're having an MI, you care if they're having a stroke or something really light and threatened or pertinent at the time. And then a question. Is the following statement true or false? A partial assessment is done when the client first enters a healthcare facility. Answer, false. Wah, wah. A partial or ongoing assessment of a client consists of data collection that occurs after the comprehensive database has been established again. So we're going to talk about the role of health assessment in the past. So for those of you who didn't have to take global trends, I'm going to explain why the history of nursing is so important to you really quick. So if we don't know what has been done in the past, we don't know the roadmap for the future. We could duplicate our efforts, or we could make the same mistake over again, and we don't want that to happen. So it's really important for us to know as a nurse what past assessment practices have been. And so physical assessment, nurses have always done physical assessments. They may not have been holistic, but they were pretty comprehensive. Nothing as comprehensive as we do now. We also relied in the past on our natural senses. If we had a hunch or the gut instinct, which comes from the limbic system in the brain, or palpation, what we thought upon palpation with the patient. We didn't follow the 4 steps of assessment, which we'll talk in depth as we go through each body system. And then the movement of healthcare from acute care setting to community. We didn't even talk about community. We didn't know how to assess community. And then going from diploma and associate degree programs, which happened primarily from World War II, as a way to get nurses to be trained and competent enough to get through the program to the bedside, because we needed as many nurses as we possibly could. From that period of time, then baccalaureate programs developed, and so here we are. Then Graduate education and advanced practicing nurses. Advanced practicing nurses are just changing the face of healthcare, in my opinion. It's one of the most revolutionary things that we have nurse practitioners. And then the one final piece of the evolution of health assessment is managed care and internal case management. So any of you have a case manager on your unit, so they're the person that really oversees all aspects of care, and they especially help during transitions when you're transitioning to get the patient to either a rehab facility or transition to home or whatever it is. They're kind of bridging the gap between acute care to the community and then to home. Places where we may see this is, of course, in acute care, critical care for sure, ambulatory care, because we worry about sending a patient home. We can't send them home sometimes if they live alone, if they just had anesthesia or other things. You have to be careful. Then in home health, you have to be sure that the patient can care for themselves and get all of the things that they need. From a public health perspective, so a public health nurse, their focus is slightly different on the geographical location, and we're going to have a whole course on that, so we'll spend some time. And then again, the focus of K through 12 nursing, which is school nursing, their focus and their assessment on their students looks a little bit different. And hospice nurses, their assessment is very different. And then other things that have impacted the way that we assess is rising educational costs, right? Going back to school is really expensive. And now we also know that the care that we provide is just way more complex. Patients are getting sicker, they are living longer than they ever have. So we're managing really, really sick patients at home that normally in the past would have been in the hospital. We have this growing aging population. So our 2010 census in the US was very revealing in that it showed that 44 million, our percentage of geriatric or people in the category of age 65 and older is going to double. So by 2040, we're going to have 60% of our population will be working and 40% will be in the retirement phase, which they will be drawing funds and resources off of the system. That's really significant. And then, of course, expanding healthcare needs. Do we all have equal access to care, and do all populations? Increasing impact of children and homelessness, that's an issue. Identifying mental health issues quickly and then getting them the resources and support that they need. And then expanding health services network. So have you noticed that every health system is now buying up all the little guys? They're now becoming these gigantic entities. And then increasing reimbursement for health promotion and preventative care services. And let me just give you one example of one that I can think off the top of my head. So chronic pain management is a really tough thing. If you're a patient, let's say you were in a car accident, you had a terrible back injury and had back surgery, and now have chronic pain that just has not resolved on its own. That's fine, except for the fact that certain pain management procedures, like if we numb the nerve and put it to sleep so that you're able to get some type of pain relief, some of those services are not covered by insurance. So those options go off the table for patients, which is totally unfair. And that's all I have today. Have a great rest of your day.